Okay, good morning to all of my dear viewers and my students. Okay, so today's session we are going to discuss a very important topics of community medicine. And what is the name of topic? The name of topic is Hills criteria. Okay, so what is the meaning of this Hills criteria? Why there is the requirement of Hills criteria? So basically, this Hills criteria, now they decide that whether any exposure is related to the disease or not. What they do on the basis of Hills criteria, we can decide whether any exposure or the risk factor is evenly related to the disease or not. So basically there are the 6 Hills criteria. On this basis we can decide whether a disease is related to the exposure or not. So the first criteria is the temporal association. Okay, so what is the meaning of temporal association and how this temporal association decide whether a disease is related to risk factor or exposure or not? Okay, listen. According to the temporal association, it tells that exposure must be precede towards the disease. What they tell? Exposure must be precede to the disease. I mean, before development of a disease, a patient must be exposure. If before the development of disease, a patient having no exposure, in that condition, the causation is not related to the disease. So this is the most important criteria which tells that exposure must be proceed to the disease. I mean, before the development of a disease, a patient must be having any exposure. If there is a exposure after the development of disease, in that condition, that exposure is not considered under the causality. I mean, causative cause. So the first temporal association, it tells that if any person having a disease and their exposure and this disease is due to the preceding of exposure, then we consider that disease under the Hills criteria. For example, if any students start cigarette smoking at the age of 20 years, and after the 20 years, I mean at the age of 40 years, he develops the lungs cancer. So here at the age of 20 years, first he having the exposure of cigarette smoking. Then after the 40 years, not 40 years, at the age of 40, he develops the lungs cancer. So here what happened? First there is the exposure and this exposure proceed towards the disease. So whenever exposure proceed to the disease, in that condition this exposure is considered under the the cause of disease. So these things tells about the temporal association. So after the temporal association, the next criteria is the strength of association. Okay, so what is the meaning of this strength of association? The strength of association means it tells that how exposure is strongly related to the disease. What they tell? It tells that how exposure is strongly related to the disease. So it is basically depend on the two factor. One is the relative risk and another is dose and the exposure of dose and duration of the exposure. So it depend on two factor. One is the relative risk and another is dose and duration of the exposure. So if relative risk of any disease is high, it indicates that the exposure is strongly related to the disease. While on other hand, if the dose and the duration of exposure, is high, so due to the due to the high of dose and exposure, it increase the incidence of disease. So if we increase the dose or the duration of exposure, that increase the incidence of disease. It again tells that the disease is strongly related to the exposure. So this is all about the strength of association. The third thing is the specificity of the duration. So this criteria is the specificity of the duration. Mostly the diseases are the multifactorial, but according to this specificity association, there is a one-to-one relationship between the exposure and the disease. But most of the diseases are the multifactorial. It depends on more than one factor. So how we satisfy this criteria, specificity association? So among the 6 criteria, this is the one criteria which is not completely fulfilled by all of the diseases, because the most of the diseases are they depend on the multi-factor, or according to this criteria there is one-to-one relationship between the exposure and the disease. I mean, there is a specific exposure for the specific disease. Some diseases definitely they follow the criteria. For example, rabies disease, it is a specific for the rabies virus. Tuberculosis, specific for the tuberculosis bacteria. But most of the diseases, especially the non-communicable disease, they not follow the specificity criteria. Okay. So after the discussion of the specificity criteria, the next criteria is the consistency of association. Consistency of association, what they tell? It tells that if there is a consistent exposure to any person, if there is a consistent exposure to the any person, in that person the development of this chances of development of disease is high. So if consistency will occur, then the chance of development of disease is high. So after discussing the consistency criteria, the next is the biological plausibility. So what is the meaning of this biological plausibility? According to this biological plausibility, there should be a biological explanation how the exposure causes disease. Okay, so according to this criteria, there should be a biological explanation how any exposure or a risk factor they cause disease. For example, if we take the examples of the lungs cancer, so in lungs cancer, the smoking is the exposure. So according to this criteria, there is a scientifically explanation that how the smoking will cause lungs cancer. So how smoking will cause lungs cancer? So basically the smoke particles, they are the carcinogenics in nature. So these smoke particles are carcinogenics in nature. They damage the DNA of the cells, and if there is the damaging of the DNA of the cell loss the control mechanism that result into the cancer formation. So this is one of the scientific explanation of the developments of lungs cancer due to the smoking. The next criteria is the coherence of the association. So what is the meaning of this coherence of the association? Coherence of association means there is scientifically evident that the exposure is responsible for the disease. For example, there should be laboratory investigation, there should be a pathological examination, there should be epidemiological explanation that this exposure is cause disease. For example, we take the lungs cancer, and so epidemiologically studies show that the smoking having a high risk of developing the lungs cancer. Laboratory studies show that a cigarette smoking causes the carcinogen, and the pathological studies show that a carcinogen damages the lungs disease. So these all are the scientifically evidence that prove that yes, the smoking which causes the lungs cancer. So overall, how many criteria? There are the 6 criteria. The first is the temporal association. The second is a strength of association. Third is a specificity, and the fourth is what? Biological plumbicity. क्या है जी? Biological plausibility. Okay, मतलब there is a biological evidence. Fourth is consistency of the association, and the sixth is coherence of the association. So these are the six criteria. On this basis we can decide disease is whether related to the exposure or not. Okay.